Let's dive in today. We're going to be talking about all the aches and all the pains. If you struggle with different broken aspects of your body as time goes on, hopefully today's going to give you some great solutions. So we'll start it out here on this slide. You can see here we've got cramps, soreness, strain, sprain, and chronic aches. And so we'll talk about a little bit of what you need to know. So generally speaking, cramps are something that occur in the muscle. So in the muscle group itself, and the most common cause of cramps is electrolyte imbalance. So electrolytes are a common cure for cramps. Now, there are different kinds of cramps. So like you can have a cramp because of post-exercise sweating and fluid loss. So it's heavy sweating, and so some of you get in the sauna and then have problems with cramps. Some of you go to the gym and work out and sweat a lot and have problems with cramps. This is where electrolytes are going to play that biggest role. So if you have one of the things that can cause an electrolyte deficiency is if you're drinking reverse osmosis water. So if you're using RO H2O, then you're going to want to make sure that you add some kind of an electrolyte back into that drink. Very important, so that you can replace the potassium and the sodium and the chloride and the phosphate and some of the other minerals that are very, very important for your muscles' ability to contract and relax. And if you're not doing that, you're going to be more prone to just generalized cramping throughout the day. Now, there's a specific type of cramping. So if you have nighttime cramping, if you're cramping at night specifically, and where we'll see a lot of this is you get in bed at night and your toes will start to cramp up, or your hamstrings will lock down on you. You got to jump out of bed really quick and start stretching. This is most commonly calcium deficits. And so I know a lot of people in today's day and age, we were told for 20 years to take calcium for osteoporosis, and now a lot of research is coming out saying you shouldn't take that much calcium, it's not that good for you. But in reality, if you're having aggressive nighttime cramping, calcium can be a lifesaver, and it can work within a matter of 30 minutes. So get that calcium in you as a trick to deal with those nighttime cramps. So cramping, pretty solid, pretty easy. If it's a sprain strain, meaning an injury, we've got to do some things to help with the repair, because a sprain strain is generally something caused by trauma. So you turned an ankle, for example, or you overused a muscle group to the degree that you injured it. And so sprain strains, the problem with these guys is they set the stage for chronic scar tissue formation. And that scar tissue, once it forms, it makes adhesions, and so it restricts the range of motion in the joint. And you really have a lot of problems long-term after sprain strain. So one of the best things to do acutely when you initially injure yourself with a sprain strain is you want to go high dose vitamin C. For adults, it's generally about 5 grams. You also want to make sure you're getting in high dose quercetin. Together they work really rapidly, synergistically, to help with swelling and to help with pain and inflammation. But more importantly, vitamin C also stimulates the reproduction of collagen. So we want collagen healing and repair. So collagen synthesis is something that we're after. The other thing you want to make sure that you're doing is a B vitamin complex. You need those B vitamins to heal. As a matter of fact, there are a number of research studies that show that B vitamins, when given, are actually very, very effective at helping with the pain of an injury. And so B vitamin complex is something that you definitely want to consider here, as well as not just the vitamin C for the collagen, but actually taking protein collagen to help heal that wound. So taking a collagen protein powder would be something that you'd absolutely want to do. Now, aside from these things, taking these things, what else can you do for a sprain strain? Well, home remedy wise, one of the best things you can do is just stay off of it for a few days. Let it rest. Don't try to put too much pressure on it. A lot of people make that mistake. Look, it's what you can go too far with bed rest, but in the initial 48 to 36 hours, or 36 rather to 48 hours, you're going to want to take time off where you're taking pressure off of it and let that initial inflammation set in and start the repair mechanisms. So if you try to do too much too quickly, you'll end up with a chronic injury. So time off is very, very important. Now, there's also an acronym. Many people, you probably heard this before, RICE, RICE. That stands for rest, ice, compression, elevation. I agree with rest, ice, compression, elevation. What I don't agree, I agree with rest, compression, and elevation. What I don't agree with so much is the ice. Ice will help with pain. So if you're really hurting, ice can help kind of neurologically suppress the pain. But what ice does is it reduces blood flow to the area. We don't want that. Remember, the body on purpose is pushing more blood into that area, and it's pushing specialized types of cells that are there to create inflammation and degrade the damaged tissue so that you can begin the repair process. So icing, actually, in my opinion, just slows that down. So skip the I and the rice and go with the RCE, and those are things that you can do. Now, some people will also use for the pain component. So like if you're trying to deal with the pain and it's just acute, you can do an NSAID, but if you pay attention to the night show, you're going to maybe change your mind on that. But one of the things I really like in this scenario is something called white willow, particularly white willow bark extract. And so anywhere from 120 to 240 milligrams a day to help alleviate some of the pain and swelling associated with that acute sprain. And you don't have to do this forever, but if you're really hurting, this can sometimes take that edge off, especially when you combine it with vitamin C and quercetin. Those can be very, very effective. Now, some people will also use different types of gels that you can apply to the skin directly that basically cause a cooling or a heating sensation. So basically, it's a distraction for your nerves to be able to feel that pain. So like over-the-counter capsaicin gel is one of those types of examples. There are also other types of gels that can be applied that contain CBD, which can also be quite helpful as well. So again, from a pain perspective, white willow, vitamin C, quercetin, all very effective. From a rebuilding, regrowth perspective, vitamin C, quercetin, collagen, B complex, all very, very important. Okay, let's move into soreness. So muscle soreness, if we're talking about generally muscle soreness, this is, when I refer to this, a lot of you, maybe you're starting to work out again and it's been a long time, right? And so that soreness can really, really set in because you're waking things back up. And so you can damage the muscle during a workout, not so much that it's a strain per se, but that the muscle itself becomes very, very sore. So how do we reduce what's called DOMS, delayed onset muscle soreness? And this is, again, generally this is post-exercise, especially any kind of newbie with exercise. And a lot of people fear exercise because of this, because of what happens. You know, if you ever had a leg day, you did some leg workout and then the next day you couldn't walk without kind of hobbling around, that's that muscle soreness that we're talking about. So in this case, one of the best things that you can take is L-glutamine. And you take L-glutamine within 30 to 60 minutes after your workout is done. Why L-glutamine? L-glutamine is one of the first amino acids to leave your muscle when you're working it out. And when it leaves the muscle, your muscle needs that replenishment, and L-glutamine will help it heal faster. A lot of bodybuilders are using L-glutamine to prevent soreness altogether, but you're gonna need anywhere from 2 to 5 grams of L-glutamine after your workout. And so I would start or err on the side of lower dose, 1 gram, start with around 1 gram and work your way up. Some people, when they go too heavy glutamine, will get diarrhea, and some people can actually get a headache from too much glutamine. And so sometimes it's better to start low and just kind of wean yourself up to make sure that you don't create a problem as well. But L-glutamine can be very, very effective for delayed onset muscle soreness. The other that's super effective are your branched chain amino acids. Now, branched chain amino acids, that's valine, leucine, and isoleucine. These 3 amino acids are very, very important for muscle healing and muscle repair post-exercise. So again, if you're trying to reduce that soreness, these can work extremely well at helping do that. And one of the other things that I encourage people to take are antioxidants. If you're starting a new workout program, actually a mentor of mine was involved in research studies involving professional football players, and what they did is they took professional football players and split them into 2 groups. They took one group and didn't give them anything. They took another group and gave them antioxidants, and then they compared their performance and their recovery, especially in those hot summers and those 2-a-day practices. And what they found is the athletes that had better antioxidant supplementation tended to perform better and recover better with less injury. And so again, this is something else that you can consider. Now, there are a lot of different antioxidants, for example, selenium and vitamin E and glutathione and vitamin C and quercetin. These are antioxidants. So there are a lot of different types of antioxidants, and I would generally recommend here, if you're trying to minimize pill counts and quantities of what you can use, is using a good broad spectrum antioxidant formula. We have something at Gluten-Free Society called Ultra Antioxidants that works really, really well in this regard. So that's something I would recommend. So again, delayed onset muscle soreness, recovery time, get these amino acids in directly after your workout, take antioxidants. It can improve your ability to recover as well. And then one of the other things that I would encourage here is choline. Whereas these agents here help with the muscle repair, one of the things that you use up during aggressive activity or new exercise programs is you use up neurological capacity too. So there's a nerve and a muscle that we have to consider for recovery. And choline is what's responsible for helping the nervous system recover post-workout. So, choline, very, very important, anywhere from 1,000 to 2,000 milligrams of choline is going to be a good amount to take, again, post-workout. And if you take this before bedtime, it has an added benefit, which it can help you have a better night's sleep and help you dream and get into a deeper stage of sleep. So these things, all what I would recommend if you're dealing with soreness, delayed soreness. Now, if you've got chronic aches, that chronic nagging injury that won't go away, you injured it maybe years ago, maybe you played a sport when you were young and you've always had this issue, or maybe you fractured an area and it never healed quite right and you have this kind of persistent chronic ache. This is my experience. The number one thing that you can do for chronic aches, number one, hands down, beyond everything else, is diet change. Because if you don't change your diet, you're never going to give your body what it needs. Chronic aches are generally a manifestation of long-term injury combined with poor diet, so your body never has the ingredients it needs to heal, but your diet is also inflammatory, so eating things that are just perpetuating that subtle inflammation that's pervasive. So with these chronic aches, diet change. What's the diet we want to do? I'm a little biased here. For those of you who know me, no grain, no pain. Now, if you haven't read the book, you should. There's a 30-day diet here, and we see this all the time in people with chronic aches, where they have this chronic problem that they've had for years. They change their diet, and lo and behold, the chronic ache up and walks away. It goes away, it says goodbye, and no longer nags them. So diet change, number one most important thing you can do for chronic aches. Now, you can throw all kinds of medicine at chronic aches, and I also see this a lot, and I'll talk more about this later, but non-steroidal anti-inflammatories, so drugs like ibuprofen or even over-the-counter aspirin, naproxen, these drugs generally work really well. They can help with chronic aches, but they wreck you on the flip side. So these drugs wreck your GI tract. They strip away the mucosal lining, leading to leaky gut. They cause B vitamin deficiencies, iron and vitamin C deficiencies, and these medications can damage the kidneys, leading to problems with elevations in blood pressure. They can increase your risk of stroke. I mean, there's just a laundry list of problems associated with non-steroidal anti-inflammatories. And where the problem sets in is when you take them over long periods of time. So if you've got chronic aches, chronic meaning long period of time, and you're using some of these NSAIDs to deal with it on a daily basis so that you can function, you're creating a huge problem for yourself. Again, we'll talk in depth about that shortly. So diet change has got to be the thing that you go to. Now, beyond that, one of the things that happens with chronic aches is you generally develop a fear of movement. So you stop using that joint or that area of the body. So if you have a chronic ache in the shoulder, what happens is people quit using that shoulder. They don't move the hands over the head as much. And so what we end up with is atrophy. The muscles, because we're avoiding movement, because it hurts to move, we start developing atrophy in that area. And it's that chronic atrophy that makes the chronic ache even worse. and develops and contributes to progression of arthritis. And so when you change your diet, one of the most important aspects beyond diet change with chronic aches is to move again. And so initially, if it hurts to move, then you move it slowly but with good intent. So doing different types of stretching and range of motion exercises, wherever that is, if it's in your shoulder, shoulder circles, up and down, back and forth, back side to side, stretching that shoulder out, hanging on a bar, and really letting and elongating the muscles around the shoulder girdle. Like those kinds of movements become very, very important to wake that area of your body up again and let your body know you're going to be using that area again, and your body is then going to preferentially send resources into that area, resources from your blood like oxygen and nutrients. So if your diet change is solid, you're getting nutrients through your food, you can also supplement with some of these other things that we've talked about. But at the end of the day, if you don't change your diet and you stick to the NSAIDs, you'll never ever beat it, and you'll actually end up in a much worse situation. A lot of people with chronic aches end up ultimately getting these steroid injections. In the steroid injections, you remember that one of the side effects of a steroid injection is bone loss. Steroids cause what's called osteonecrosis of the bone, so they strip away the integrity of the bone, and that leads to, in that area, in that joint, that leads to further potential deterioration. Steroids also cause elevations in blood pressure, elevations in blood sugar, water retention, so it's just not something you want to do. And a lot of doctors will inject somebody multiple times to try to deal with chronic pain, and most people get about 3 to 6 months of improvement or relief from a steroid like that, but that's it. After that 6-month period is up, the pain comes right back, only now you've done the damage with the medication and you still haven't changed your diet. So if you want to get rid of chronic pains, diet change as a home remedy is where it's at. Let's talk about back pain. There's a lot of different types of back pain, and I think it's important to kind of differentiate, because there's just generalized low back pain or generalized mid back pain, which a lot of times can come from disuse. When I say disuse, I mean like a sedentary job where you're sitting down all day and you don't have an exercise plan, you don't have a stretching plan. Like one of my favorite ways to deal with back pain in patients is to make sure that they're not sitting at a desk all day. And so one of my favorite, we call it a home remedy, is the treadmill, the desk treadmill. I have one under my desk when I'm on the phone for hours a day. Is something that I make sure I'm putting in a little bit of mileage and not just sitting around all day, because it's that sitting that doubles the pressure in the low back and the spine area and can actually create the back pain. But it's also that sitting chronically that causes atrophy of the low back muscles. And so as these muscles start to shrink, they compress the joints, and that can lead to different types of pain. So there's just general disuse or sedentary pain, in which case, again, the best treatment, if you don't have place for a treadmill, is just activity, is making sure that you're getting up and doing activity. And so stretching has got to be a part of that plan as well. There are a number of different types of stretching exercises that you can do for your back. One of my favorite stretches or types of stretch is to hang from a pull-up bar and let gravity stretch the spine. And as you're hanging, you can twist your waist, you can twist your legs back and forth, and that helps give you some rotational stress and force on these paraspinal muscles that run up and down the length of the spine, and that can really help to loosen you up. There are also a number of other stretches. You can do toe touches, you can do knee bends, you can bring knee to chest. I mean, there's so many different stretches that you can do for this area that can be very, very helpful to relieve the tightness as a result of sitting chronically. Now, there are other types of back pain. So, and another example would be a herniated disc. Some people develop pain as a result of trauma or injury to a disc. And this is a little different. With a herniated disc, walking on a treadmill is not going to be your solution so much, because what has to happen is you got to take pressure off the disc. So with something like this, one of the best things that you can do is traction. And this can be a home remedy. You can ask your doctor to prescribe you a traction unit for home use, and you can go out and buy one, and you can write it off on your taxes and all that. I'm not an accountant or a tax advisor, but that's kind of what I would look for as a home traction device. And one of my favorite is called a 90/90 traction unit, and this is a device that's easier to get into. Some people buy those traction devices that it's the machine, you get in, you get the boots, and you flip upside down and you hang upside down. And those are good too, but the 90-90 is better because the 90-90 allows you to flex your knees to 90 degrees and your hip to 90 degrees. And you have a device it's easier to get into, and you can flip upside down. And again, it's a gravity traction that can just allow for a subtle stretch. And when you can stretch out an area where that disc is, that a lot of times that disc, the pressure that disc is pushing into the nerve root will ease up with that traction. But this is something, again, from a home perspective, we're talking about, 20 plus minutes a day, and not at the same time. Some people don't do well upside down for 20 minutes solid, but 20 minutes in accumulation over the course of the day or more. So, multiple episodes. What I like to do is get in mind, I actually have one of these, and before I work out, I'll actually traction my low back to get ready, especially if I'm going to do something that requires a lot of low back activity, and I'm going to traction that out and stretch it out really, really well. So again, I'll do that for a few minutes before a workout. But again, if you're dealing with a disc herniation, you may want to look at a longer time frame. Now, you can also, again, not a home remedy, but you can also visit a clinic where a doctor's got like a decompression device or a traction device that they can put you in and allow for that stretch. But I've seen more cases of disc herniation where people were on the, they were slated for surgery, and traction saved them from needing surgery. Traction, diet change, and nutritional supplementation are things that can save a person from needing to go forward with surgery in a lot of cases. Now, there are cases where surgery is necessary, but start with the conservative aspects first, and that's what these things here are. Now, you might also consider with low back pain, even with degenerative, you might consider something called myofascial release. So you find a doctor that performs myofascial release. That's typically a good chiropractor, and a good doctor will also teach you things that you can do at home, because not all stretching is good for a herniated disc, but certain types of stretches are. And so again, myofascial release to strip the tissue out around that area, stretching, and then there's another type of activity that works great for discs, and those are called McKenzie exercises. And you can Google this, and you can find a number of different low back McKenzie maneuvers. McKenzie exercises are basically repetitive arching of the back, so it has an effect on the disc that can greatly help and centralize the pain and help that, especially if the pain from the back, from the disc, is radiating down the leg. It can be very, very helpful. So those are things you can do, when that low back is hurting.